Good afternoon. I'm Bobby Watts, the CEO of the National Healthcare for the Homeless Council, and I am grateful for all of you who have joined us for our Homeless Persons Memorial Day event. The National Healthcare for the Homeless Council and the National Coalition for the Homeless started this observance over 30 years ago and have been continuing this ever since. We're grateful that we're joined by our partners this year with the National Alliance to End Homelessness. And what began as an event in a small number of cities has been going on every year since 1990, and it's now being observed in more than 100 cities in the United States and around the world. So we're very grateful that you have joined us today on this, the longest night of the year, to remember and to commemorate those who have died while experiencing homelessness, because we know in almost all of those cases, these are deaths that have occurred prematurely and unnecessarily, and often in too much pain than is warranted, than if we as a society had provided housing and healthcare. The National Healthcare for the Homeless Council believes that healthcare and housing are human rights, and we believe that housing is healthcare. And there are things that we can do as a society that we need to do in order to make sure that people can live a full life. We know that people who die while experiencing homelessness die around the average age of 50. This is true in this country and also around the world. And in this country, the average life expectancy is about 79 years. So that means that each person who dies, almost without exception, every name that we will be reading today died prematurely as a result of the lack of housing, healthcare, things that we believe are basic human rights, but that everyone can agree are basic human needs. One thing as a society that we have learned one thing we have learned as a society by the COVID epidemic, and notice I said by and not by going through the pandemic, because going through could imply that we are done with the pandemic, but we are not. One of the things we've learned is that people want a roof over their heads and a door that they can shut behind them. I've been pleasantly surprised after doing outreach here in Nashville with the local ministry to encampments, where many people over the years before COVID would say repeatedly that they did not want to go indoors, into a shelter or into the mission, but they wanted to stay outdoors. But when these people were offered a hotel room or a situation in a house where they had their own room, many of them took it. And I've been pleasantly surprised by how many of them now are getting their lives back together. They're able to keep their medical appointments. They're able to keep their treatment appointments, to get their documents, and to participate in a greater way in the workforce. So we have reaffirmed that housing saves lives and that being unhoused is deadly. I am here in Nashville, Tennessee, and we had our observance last Saturday. And we saw that, I crunched the numbers, and we saw that of the average age of death was 52. The median age of death was 54. The youngest person on that list was 1 year old, and the oldest was 75 years old. And for the second year in a row, at least, we see that the oldest person on that list did not even reach the average life expectancy of someone in this country. So that is an astounding fact, which really underscores we are almost dealing with people who are living in conditions as if they are in two different countries. And that is because we are denying basic human rights and needs to people. So we know that housing and services end lives. Both cost money, but money that we have in this country, and it is money that is well spent. Every name that we will read today and the life behind it and the unfortunate death behind that name, connected with that name, is a testimony that we have done a lot, but that we need to do more to get people into housing. We need to do more so that we will stop robbing people of lives and years and everything that's associated with it, the wisdom, the friendship, the caring, the laughter, the singing, and the giving from our homeless neighbors. And really, when we lose them, we as a society lose rich experience and wisdom as well. So we can and must do more so that all of our neighbors without homes can at least have a chance for a full life and a full lifespan. We are grateful that you are joining with us today because we want to make sure that our homeless neighbors who have passed away are not forgotten. And by remembering them as individuals, but also as a group, we can shed light on the fact that this is avoidable and that it can strengthen our resolve to do what we can so that we will have fewer deaths of people experiencing homelessness in the future. So today, we will have two National Consumer Advisory Board members, Randall Loeb and Kendall Clark, to represent the consumer perspective. Consumer is the term that we at the National Healthcare for the Homeless Council use for patients that have received services in our clinics that have experienced homelessness and that are now giving back. Yola Tepper and Kayana Clark are here from the Night Ministry in Chicago to talk about the role of providers and the effects on their lives when tragedy strikes. We have Jeff Olivet from the U.S. Interagency Council on Homelessness and Ann Oliva from the National Alliance to End Homelessness to talk more about what we can do to advocate for change. We hope that we can all learn something from this event, but also have a chance to grieve together our loved ones. Housing is a human right and the real solution to end homelessness. Housing and services saves lives. I'd like, before turning it over to Rajni Shankar Brown, have a moment of silence. Please observe the silence in any way that is meaningful to you. Thank you. I'd like to introduce and turn over the next segment of our program to Dr. Rajni Shankar Brown, who is among the most prominent educational scholars in social justice in the United States and internationally. She has published leading works, presented around the globe, and received numerous awards for her innovative leadership and ongoing community engagement projects. She has been a dedicated board member and effective board member of the National Coalition for the Homeless for some time. And we're honored to have you here, Dr. Brown. Thank you.
Thank you so much, Bobby. I am so grateful today to be able to be in community. This is such a moving day and such a critical and important day. So I really want to thank the National Healthcare for the Homeless Council, Bobby Watts, for your leadership, all of our amazing speakers who are on today, and everybody who is joining us to honor precious lives that have been lost and to come partner with us for this critical mission to end and prevent homelessness and to make sure that every human life has the chance and opportunity to be treated with dignity and to live to full potential and manifestation. Namaste. I am Dr. Rajni Shankar Brown. I have the honor and privilege of serving as the president of the National Coalition for the Homeless Board. The National Coalition for the Homeless is a national network of people who are currently experiencing or who have experienced homelessness, activists and advocates, community-based and faith-based service providers, and many others who are coming together for a single critical mission: to end homelessness while ensuring the immediate needs of those who are experiencing homelessness are met and their civil rights are protected and respected. We believe that safe, decent, affordable housing is a human right, as declared in the Universal Declaration of Human Rights, Article 25, Section 1. And today, we are gathering to remember and to honor precious lives that have been lost to the humanitarian crisis of homelessness. I'm so thankful for the silence that Bobby gave us in this space, for us to be able to open our hearts and not just honor in words, but to also feel, and to also feel inspired as we move on today, to make sure that we are working as hard as possible in our communities, in our lives, to make sure that everybody has life, that human rights are truly protected. We live in one of the wealthiest nations in the world, and to have people unhoused is simply unacceptable. Every year we have friends, neighbors, brothers, sisters, fellow human beings who quite literally have to weather the weather. And we lose so many, too many lives each year. It is devastating to know that so many people who have died on the streets, who have died in encampment sites and in the woods, are not able to have a funeral, don't have access to support systems to properly honor them, and that their lives could continue to be having their heartbeats still in motion if we had our human rights in place. It is this injustice that is bringing us here together today. And it's my hope that we work to end and prevent homelessness so that we no longer have to organize, have the need to organize this memorial, this critical memorial every year. This is such an important memorial, but how wonderful it would be to imagine a world where such a memorial need not exist, especially knowing that we live in a nation with more than enough resources to end homelessness. As Dr. Martin Luther King Jr. wisely advised, the problems of racial injustice and economic injustice cannot be solved without a radical redistribution of political and economic power. Today, the National Coalition for the Homeless, in partnership with the National Healthcare for the Homeless Council and many others, all of us here today, we are commemorating December 21st, the longest night of the year, a night with freezing and below freezing temperatures in so many communities across the landscape of the United States, to recognize our brothers and sisters and fellow human beings. The Homeless Persons Memorial Day, a day that began in 1990, we again gather to remember all those who died during the year without housing, without the fundamental human right of housing. Decades later, our nation's housing crisis has significantly grown, with millions of individuals, families, children, and youth without access to safe, affordable, accessible housing. And again, too many precious lives lost. Today, we honor and we uplift those lives, those precious lives, lost due to unacceptable violence of poverty, the violence of homelessness. And we, the people, we are demanding a redistribution of political and economic power. We are asking that all of us affirm and reaffirm a commitment to truly building beloved community, a community where equity, inclusion, social justice, environmental justice are not just rhetoric, but are actual manifestations that we all get to experience and live. This day is about love. It is about our shared humanity. It is about housing justice. And it is a call for collective action. We are all long overdue to be all in. Today, we rise together calling for mindful, urgent, meaningful policy changes to ensure that no life is lost due to homelessness, that every life has accessible housing, food, fundamental human rights, again, human and civil rights. I am reminded of the wise words of Angela Davis, who said, "I am no longer accepting the things I cannot change. I am changing the things I cannot accept." As we honor all of the lives that we have lost over the past year, over the past decades, let us remember that our march continues, that housing justice requires genuine commitment, collaboration. It requires moral courage, especially as we have rising criminalization in our nation against people who are unhoused. Today, I have the privilege of moderating and introducing our esteemed speakers. And I also want to give everybody a warm welcome today on behalf of Donald Whitehead, our Executive Director at the National Coalition for the Homeless, who couldn't be here, but is here in spirit. I would also like to celebrate the partnership, as you will see here tonight with our amazing speakers, the collaborative spirit of our memorial, a reminder that together we can do so much. I'm going to now introduce our first speaker today, Randall Loeb. Randall is a great-grandfather, a chaplain, an author, an educator, a public servant, chair of the Colorado Social Legislative Committee, and a patient at Stout Street Health Center. He is a member of the Colorado Coalition for the Homeless Consumer Advisory Board, Renaissance Housing, and the Colorado Coalition for the Homeless Board of Directors. Randall believes in nothing about us without us, the mantra of the Cross Disabilities Coalition. He has written eulogies and pastoral prayers for people who have died living on the streets. He has been recognized for opening prayers that he has given before the Colorado General Assembly and has spent over 2 decades inspired and honored by the lives of those who we miss. Randall says, "We're on a hero's journey to at last come home." Randall, so wonderful to have you with us today. Thank you.
Likewise. So my notes begin with remembering for change. I don't look at us as limited. I look at our possibilities and options. And for that reason, I have to look forward, not back. And though I've become involved in the Colorado Coalition and all of its organizations and structure, I really feel indebted to this place for my survival. I was a person who was on the brink of committing suicide at the loss of my children and my family and my relationships at the advent of 9/11. I was in a coma a week beforehand in a prominent hospital. And when I got out, I was asked by John Parvinsky and members of this organization to speak at the time that they were developing 10-year plans and when the group of people was creating the 11 housing first options across the United States. I was in Washington, D.C. at that. I met Jeff years and years and years ago. And I was influenced by all of the people who are here in this and all the people who are involved in this place that I am to make a contribution as simple as possible. So what I said the first day that I spoke was that we need to listen. But I now revise that. I believe that we need to listen to homeless people, but we also need to include them as partners, as champions, as persons with possibilities and options to offer, and as companions in doing this, because reverse trauma is as important to recognize as the trauma that people like myself experience. And even though we may continue to struggle and not be a poster person for having success, we're still worthy. And as was said by both of you, we're worthy to be able to be safe and to be secure and to live out our lives with dignity, which is the reason why I've participated in these vigils since the Catholic Worker House actually started them in a period long, long ago in the 1970s to change the time frame, and which the Colorado Coalition took over because one of its founding members was Anna Koop, who was involved in that iteration of things. And I lived in the Catholic Worker House for a time. And I can say surely that this is a collaboration, not just of the partners, not just of the presenters, not just of the organizations, not just of the superstructure of policymakers, but also of us. Because without us, as it was said by you, there is nothing we can do to change this equation. We must be honest that sometimes people want to fix things that basically are amiss, and they have been because of trauma. And I don't know how you can basically wave a magic wand and expect somebody to live in housing who's essentially lived on the edges of things for so long. It takes a tremendous amount of courage. And I talk about it as a hero's journey or champions because of the fact that I feel that my life is of worth and value. And when I meet people who are struggling, I listen to them very carefully. I might not be able to change what's going on, but I can still be present to them. And I've always felt that that made an incredible difference, especially if somebody was struggling with the life and death issues that are faced by our community on a routine basis. We're about to have temperatures that are negative. We're about to have a situation where nobody, for any reason, regardless of the circumstances, should be outside. And nobody should be in a circumstance where they have to make a question about it just because of the fact they use drugs, or an IV injection drug user, or a person who's been thrown under the bus and basically feels as if they don't have a right to be safe. And until the business community, the policymakers, the organizations that support all of this begin to work with us clearly and deliberately, like in our new recuperative care center, which I pushed for them to do, we cannot possibly expect us to come out of the troubling experiences we have and make it, and actually make contributions that are worthy of our position in this equation. So my first thing in the very beginning was not only to listen to us, but involve us in the decision making. I was the first president of the Metro Denver Homeless Initiative, the continuum of care, who had been homeless way back long ago when we were just struggling to exist. And I think some people were kind of confused about that. How could we basically take a role of responsibility for an organization that had such a lot of importance in terms of getting funding? Well, if you look at our Charge Resource Center here in this city, people with profound mental health problems over 50 years have had an equal and equitable relationship, parity, with the people who are doctors and who present the issues to us. And if Ed Farrell was here, my doctor, he would say to me, I wouldn't be able to do what I do without you. So I must stress that that's the kernel of doing something to change the equation for homeless people. If you want us to survive, and I'm nearly 72, you'll think about us as a profound contributor to our welfare and the development of your policies and programs, no matter what, even if it's difficult to come up with a profound decision. It's essential for us to make it, to change what actually is unjust and obviously wrong. So I was asked to present a story after that lecture. And it seems to me that what I remember vividly is the number of women that I have known in my lifetime here, which is over 30 years now, and how individuals that I knew, like this woman who was a secretary here, who had a family here, a daughter here who was in a home, could possibly abandon her children, their mother. And she was struggling with alcoholism, which was the reason for the problem. And she lived in a van, and it was really hard for her. And I was riding my bicycle. I live as simply as possible. And I noticed that she was in an alley because I recognized her voice. And I came over to her and she was hardly clad. A short time after that, she froze to death. I've known many other individuals with that kind of a story, basically, who would try to hide someplace in order to get out of the cold on a night like this. And in the early days, before they developed everything in the hub down here, 7 people died who were on the street. And there's a plaque at one of our organizations that basically honors their memory. I was a writer at the Denver Voice newspaper at the time. This was in the 1990s, 1999 to be precise. And I always felt like if there was really a time when we needed to open up a place like we have in our warming centers, or have a 24/7 shelter, or have other options for people, it is now. And it shouldn't be a thing of us quoting individuals to say, well, when will it be appropriate to do that? The answer is it has to be done as of this moment in order to make it possible for us to house everybody, the immigrants, the people who are not coming out of jail, people who are undocumented. I don't really care what the situation is, because a lot of our kids are also on the street and they don't have anywhere to go. And I'm very thankful that I'm a great grandfather and have a family that basically is taking care of themselves. But not everybody can say that. And not everybody can say they came out of the trauma of their own birth and their own beginnings and know what it's like to die with dignity when they get to that point, because they suffer so much along the way and have for generations. That has to be cut off. And I don't know about you, but to me, it's untenable. Every time I see it, I feel a cringe in my consciousness. We have an oak tree behind our building that's been there for at least 15 years that basically suggests that for every leaf that grows on that tree is a person who died. And at the base of it, it says, here are our brothers and sisters who we miss, who died, who lived on the street. And I've always said that this was an important mark to have in every community throughout our country, just to remember the fact that we're here, we're worthy, we belong, we're part of the equation. Now, thank you for allowing me to preach for a moment.
Thank you so much, Randall, for not only your moving words, but your insights. There is much work to be done, and beautifully said. And I can imagine the oak tree as you just spoke right now. What a good visual for us to remember as we continue to do this work. I now want to go ahead and introduce our next speaker, Maud Harrison Hudson. And Maud is an ordained UCC minister, grief counselor at a hospice, and Sunday morning chaplain at a military retirement facility. Maud writes obituaries, conducts funeral services, and facilitates wedding ceremonies. Carrying a unique approach to dying, death, grief, and nurturing support, has supported thousands of grieving clients, has developed and facilitated many grief and loss workshops, and supported groups, including groups focused on child loss, suicide, drug overdoses, and racial injustices. Maud is also a blogger, a podcaster, and a writer. She is a mother of 3 children with a living son, 2 daughters who are deceased, grandmother of 7, and a late bloomer who describes herself as still flourishing. Minister Harrison Hudson, thank you for being here today, and we look forward to hearing from you.
Thank you so much. Good afternoon, and thank you to Dr. Deborah Gilbert White, who invited me, the National Council for the Homeless and the National Healthcare for the Homeless Council. I appreciate the opportunity to participate in this year's persons this year's homeless persons Memorial Day virtual event, as we remember the homeless that were lost this year. Everybody deserves to be remembered with dignity, no matter what their station in life has handed them. And so we grieve. Grief and loss impacts the homeless in multiple ways. The deficits of not having a safe and secure place to live, loss of identity, loss of control, loss of balance, loss of self-esteem, becoming institutionalized, increase in substance misuse, loss of the ability and will to care for themselves, increased danger of abuse and violence. What is grief? Grief is a natural response to loss. It's the emotional suffering that you feel when something or someone you love is taken away. Often the pain of loss can feel overwhelming. You may experience all kinds of difficult and unexpected emotions, from shock or anger to disbelief, guilt, and profound sadness. The pain of grief can also disrupt your physical health, making it difficult to sleep, eat, and think straight. Grief affects us physically, mentally, and spiritually. These are all normal reactions to grief, and the more significant the loss, the more intense your grief will be. Coping with the loss of someone or something you love is one of life's biggest challenges. You may associate grief with the death of a loved one, which is often the cause of the most intense type of grief. But any loss can cause grief, including loss of a home or safe place to live, loss of health, loss of a job, loss of financial stability, retirement, a serious illness, loss of safety after a trauma. And even subtle losses in life can trigger a sense of grief. Whatever your loss, it is personal to you, so don't feel ashamed about how you feel or believe that it's somehow only appropriate to grieve certain things. If the person, relationship was significant to you, it's normal to grieve for the loss that you're experiencing. Whatever the cause of grief, know that there are healthy ways to cope with the pain that in time can ease your sadness and help you come to terms with your loss. It is important to know that self-care, it is important to take into consideration your self-care. Self-care is not an option, it is required. So learn to love yourself. Take a little time for yourself each day and a big chunk once a week. Give yourself some real relaxing moments through meditation, relaxation techniques, and things like massage, beautiful music. Learn self-reducing techniques. Recognize your own self-worth. Recognize your own needs and limitations. Drop the need to be responsible for everybody else and everything else. Learn to conserve your energy and use it where you choose. Put into practice some of the good advice that you would give to other people. Develop that part of you that wants to laugh. Seek out humor in your life. And above all, don't take yourself too seriously. Develop a strong support network for yourself. Allow yourself permission to ask for help. Set limits. This may mean having to say no sometimes. No is a complete sentence. Do not have unrealistic expectations of yourself. And then here are some 5 C's for balancing sorrow and celebration while you're grieving. 1, choose. Think ahead about what you really want to do on a particular holiday or special day. Have a choice rather than falling into a trap of feeling that you have to do certain things. Be willing to change. Number 2, your world has changed and been turned upside down as a result of your loss. So be willing to allow yourself to make changes rather than feeling you have to do everything the way it was always done. Communicate. Let people know what it is, your family or whoever the people are who are close to you. Let them know what it is that you need and don't need for special days. Be honest as possible with each other. Be willing to compromise. We grieve differently and we have different needs. One person in the family may need to have everything the same. Someone else may want it different, and another person may not want to do anything at all. Be willing and open to those around you. And 5, comfort. Be good to yourself and find as much comfort as you can for yourself in your time of grief. Do these things that help you to feel good every second and every minute. Our loved one would not want this for us. So it's okay to feel times of joy, times of fun, and times of celebration while you're grieving. It is not disrespectful, and it does not mean that we didn't and don't love them deeply. And in closing, there's a poem from Rachel Naomi Remy. Grieving allows us to heal, to remember with love rather than pain. It is a sorting process. One by one, you let go of things that are gone and you mourn for them. One by one, you take hold of the things that have become a part of who you are and build again. Thank you so much.
Thank you so much. We really appreciate the wise words and critical reminder to self-care and community care and to allow ourselves to grieve, however that looks for each of us. So thank you so much. Really appreciate that. Beautiful. Yeah. It's now an honor to introduce our next speaker today. Our next speaker is Jeff Olivet, Executive Director of the U.S. Interagency Council on Homelessness. He has worked to prevent and end homelessness for more than 25 years. And as a street outreach worker, case manager, coalition builder, researcher, and trainer. And he has quite an extensive bio, so everybody please go look at it. It's such an honor. Jeff, I've had a chance to work with Jeff on our Bring America Home Now campaign and consider Jeff a friend as well. So Jeff, wonderful to see you and thank you for being here today.
Rajni, it's so good to see you and all of you. Thank you so much for holding space for this. Thank you to the National Healthcare for the Homeless Council and the National Consumer Advisory Board, the National Coalition, the National Alliance. This is such an important time every year for all of us to come together and to hold space in remembrance of those who have left this earth without a home in the last year. For anyone living in the Northern Hemisphere, tonight will be the longest night of the year. For people living in Anchorage, that means 18 hours and 32 minutes of darkness. In Denver, 14 hours, 39 minutes. In Atlanta, 14 hours, 6 minutes. And here where I sit in Washington, D.C., 14 hours and 34 minutes of darkness. Now, some people will wake up tomorrow, look out their window, and complain that the sky outside is still dark. Some will carp about the cold and wish for longer days with more sun. But the night will be longest, it will be coldest, and it will be darkest for those living without a home. Each year on this day, we gather together to remember those we have lost. I've been involved with these services for more than 25 years. Many of you have as well, as we heard from Randall and Bobby and others. Here in Washington, at least 77 people died without homes in the last year. As we read their names earlier today, and as communities across the nation have come together today to read names, we must hold them in our memory. They were brothers and sisters, sons and daughters, friends, and they died of treatable illnesses. They died of preventable overdoses. They died of violence that did not need to happen, and indeed would not have happened if they had been in the safety of their own homes. I believe that it does not have to be this way. I believe we can do better. And I can imagine a time when the days are longer and the sun is brighter. I can imagine a day when we have enough affordable housing to go around, when we are no longer playing musical chairs with people's lives to get into those units. I can imagine a day when we have enough mental health and substance use treatment for all who need it. I can imagine a day where we help people stay in housing so that they don't have to become homeless to get the support and help they need. I can imagine a day when, even if a family is in crisis, they have a safe, dignified place to go as they get back on their feet. And I can imagine a day when, on the longest night of the year, we don't have to read any more names. Thank you for being here. Thank you for what you do every day. We are in this together until homelessness is a thing of the past.
Thank you so much, Jeff. Well said, and absolutely, right? Our goal and our hope, as we imagine and know that we can end homelessness, is that we no longer have to have this memorial. We can have other memorials, celebrations even, but not this, which we know is preventable and we can end. Thank you so much, Jeff, for being here and for all that you do. Next, it is an honor to introduce our next speaker. Anne Olivia is the CEO of the National Alliance to End Homelessness, a career veteran of homelessness and housing policy, and recognized as one of the foremost experts on homelessness in the nation. And thank you so much for being here today. I know you also have a very extensive bio, but with our limited time, I'm just going to turn the mic over to you, and I appreciate you being here.
Thank you so much. I want to thank Bobby from the National Healthcare for the Homeless Council, the National Coalition for the Homeless, for inviting me to be here today. I'm just humbled to do it. And Rajni, I want to thank you for starting this conversation by talking about love and saying that this day is about love, because I think that that's true. And I hope that everybody sort of holds that as we are talking today and as we're reading names today. I make it my habit to walk through or around McPherson Square, a small park here in the District of Columbia that's just blocks from the White House. So I make it my habit to walk through McPherson Square most days when I'm here in my office at the National Alliance to End Homelessness. The last time I counted, there were about 40 tents in that park. And I do that because I believe that the only way that I can do my job with the rigor and the urgency and the commitment that's needed is to talk with people who are experiencing homelessness and remind myself every single day of the incredibly high stakes that are involved in leading an organization like mine. And just before Thanksgiving, on my way to the office from the Metro, just half a block from here in McPherson Square, I witnessed a man suffering from hypothermia who was being transported to the hospital. One of my staff members, Jerry Jones, who many of you probably know, came in when I called him to McPherson Square to find out who that person was that got transported to the hospital. And Jerry and I learned later that morning that he didn't make it. The name that he was known by in the park was Al. He had people that asked about him, about what happened to him on my way home that day. And he had staff from Pathways DC who knew him. He is on our DC memorial list. His name was read, his initials were read earlier today at our in-person memorial. And the question for me and for all of us who are here today is, what do you do when someone dies from an avoidable and tragic death? So first, we remember them and we honor their memory. That's the reason why we're all here today. It's why we did an in-person memorial earlier today at the Church of the Epiphany here in the district. It's why you all have them in your local communities. But I think it's really important that we don't just remember and honor them at memorial services. We have to carry their memory with us when we feel like this work is too hard, when we feel like we're not making enough progress, when we feel frustrated or angry at the systems that we're trying to change. And hopefully, when we remember, it helps to provide us with a renewed purpose as we go forward and as we stay in the fight to end homelessness. Second, we work to remedy the cause of their death, to correct the systemic wrongs that have caused homelessness so that we protect others from suffering the same fate as best as we can. We know that ensuring that everyone has a home, and it's a simple concept, isn't it? It's a simple concept that everybody has a home. We know that is the solution to homelessness. As a nation, we have to be willing to spend our resources on affordable housing in order to do that. Even now, today, here in the District of Columbia, Congress is considering a spending bill for next year that expands homeless services a bit, a pretty big jump for homeless services, which is great. It is a very good thing, but it adds only a small amount of funding for new affordable housing. So we need to work together to demand that Congress and all of our elected officials address our nation's housing crisis with resources that are in line with the scale of the problem. And third, when someone dies from an avoidable, tragic death, we have to demand justice. A preventable death is an injustice that we cannot and should not ignore. And that is only really addressed through the pursuit of housing justice and racial justice. and justice for all those who have been marginalized in our community and in our society. We need to clearly say and loudly say that housing is a human right. So today we remember the loss of life suffered this year, as we did last year on this day, and the year before that, and frankly, for as long as I can remember. I've been doing this work for 30 years. I hope that one day we don't need these events because we'll have achieved all the things that we are looking to achieve. But until then, I hope that we, everybody who's on this call today, and folks who are doing these kinds of events all over the country, I hope that we'll continue to work together and work really hard to achieve those goals. Thanks again for having me today. I really appreciate being here.
And thank you so much for being here. And absolutely, as someone in the work 30 years, just like you, that is the hope, right? That this doesn't need to happen. We know that it's preventable, it can end. And I love what you said, right? That until then, let's continue to work hard, work together. Thank you so much, Anne, for sharing and for all that you're doing, your leadership as well. Next, it is an honor to introduce the next two speakers. We have today with us Kayana Johnson and Yoella Tepper. Kayana Johnson has been serving the homeless community for a little over 2 years. Prior to joining the night ministry, she completed her bachelor's in interdisciplinary studies at the University of Central Florida. Kayana was inspired to take a more active role in the community because of their grandfather, the late Johnny Johnson Sr., who always sought to serve others and made a huge impact in his hometown. Kayana is now pursuing a master's degree at the University of Illinois at Chicago to become a nurse. They are thankful to their clients, their team members for inspiration and motivation to find a different avenue to serve people who are houseless in the community, in hopes that we might improve the care and services offered to them. Kayana, thank you so much for being here. I'm also going to read the bio for Yoella. Yoella Tepper has been in night ministry for over a year, with more than 5 years in the nonprofit healthcare administration role, and it has lots of experience there. Before taking a more professional role in harm reduction, Yoella worked in theater and in circus production. After a friend passed away in 2011 from oxycodone overdose, they began to educate themselves and anyone else who would listen about harm reduction and overdose prevention. They are not clean or sober, but constantly works towards applying harm reduction to their own substance abuse and hope to be a pillar to support their clients in this way. Yoella, Kayana, thank you again for joining us today, for being here. And thank you. I'm going to give the mic to you.
Hi, everyone. Thank you so much for having us. Thank you so much, Dr. Rajni. We do have a presentation. I don't know if folks are able to see it or there it is. Amazing. Beautiful.
Looks
Awesome.
great on our end. Thank you.
Oh, thank you.
Cool.
You can go first.
Yeah, you can go ahead to the next slide. So I'm Kiana. I'm the lead street medicine outreach worker.
And I'm Yoella, and I'm the substance use specialist at the night ministry.
So we are part of the street medicine team, part of the night ministry. And what we do is we're in an outreach van that we go around to folks living on the street, and we offer services ranging from food and clothes to harm reduction supplies to medical services and case management in terms of IDs, birth certificates, and then trying to get people connected to housing.
Next slide.
So this is our team. That's our van that we go around in, and it's a very robust team that we we got going.
Next slide, please. Okay, so just to kind of jump into things, just to give everybody a little bit of context about what goes on in Chicago and why do we exist and why do we have to exist as a nonprofit to do this work. So this is the proposed budget for Chicago 2023. Basically, it's split into these different sections here. You can see that public safety takes up almost takes up the biggest portion of it. And displacing and evicting our neighbors on the street, it falls into two of these categories. So it falls into public safety, which includes police and police accountability in Chicago, and then infrastructure services, which includes streets and sanitation, who actually come to the encampment and clean up and take things away. Now, support for people experiencing homelessness in Chicago falls under two categories as well: the community services and the city development portions. And this totals 3.9% of the budget. And now that whole budget is not exclusively for people who live on the street, but that is all that exists for the help in Chicago, basically. This kind of just speaks for itself as to why there's such a significant issue with housing and taking care of all the citizens in Chicago. Next slide, please.
So now we're going to talk a little bit about what the street cleanings look like in the city. We can go to our next slide. So a typical eviction or street cleaning will look like the city will identify an area that needs to be cleaned, and they do this by putting up sticker notices at any encampment, and they will notify residents of the date of the cleaning. And when that date comes, street and sanitation will bring the dump truck, and the staff will take any trash that is left at the encampment. And oftentimes that includes pretty much anything that is not occupied or that the person or the resident is not, holding on to or claiming as their own. Next slide. So how are people affected by this? In several ways. One of the main ways is loss of treatments, anything from medications to instructions for how to use those medications, for instructions in getting to medical care, medical appointments, things like that. One of the biggest things is identification, I believe. State IDs, birth certificates, social security cards, anything related to a person's disability payments, anything like that. And it can set people back for other services, especially for housing. People need an ID, they need your birth certificate, they need your social security information to get you connected to housing. And when those street cleanings happen, everything is taken away, and people lose out on those things. And that sets us back personally in offering services to people, because then we now have to start that process over with them and get them connected and get them those forms again. Then we move on to loss of contact. So I think many of us have the similar experience that in working with anybody who lives on the street, having consistent contact with that person is difficult. Not everybody has a phone, and if they do, it's not always easy to charge it. And so when these street cleanings happen, and streets and sanitation will take everything, that also includes phones, phone numbers for case managers, phone numbers for doctors or nurse practitioners, any sort of contact information for anything that's important for that person, even personal contact information for family and friends that they are trying to remain in touch with. And then we get to the last point of judgment and scrutiny. Oftentimes, neighbors who are trying to do the nice thing and drop off items to our friends on the street usually leave random donations that are often useless or unused by the residents. And from that, those residents are often judged for the piles of trash that are left behind. You get things like canned foods and breads and, leftover meals and things like that. which unfortunately residents aren't able to use those things long term. There's no way for them to keep food refrigerated or a way for them to reheat things. And so oftentimes it'll pile up, and then they will face scrutiny from other people in the areas for those piles of trash. And then we will start that cycle over again, where the city will tag their encampment for cleanup, and we will deal with all of these issues again. Next slide. You can go to the next.
Okay, so I'm going to talk a little bit about my first client death. Next slide, please. So I can't tell you his name, but I can tell you about him and what he was like. So my client loved cigarettes, loved to smoke cigarettes. He loved apple pies and would constantly ask me to buy him the McDonald's apple pies because he just had a really big sweet tooth, just like me. He loved metal. He loved music. He loved rock and roll. He loved to party. He was a big partier. And I really appreciated that about him. And we got to talk about his partying days back in the day. And he was also a dad, and he had and still has 5 children who live in the Chicago area. He loved metal music so much that he was actually buried in an Iron Maiden t-shirt. I don't know if Iron Maiden is metal, rock, whatever it's categorized as. Sorry, I'm not a listener to anybody that's a fan of Iron Maiden. But that's who he was, you know, and I kind of, you know, at the end of his life, towards the later part of his life, you wouldn't have really known it, but I really did think he was kind of like if anybody watches Stranger Things, a Eddie Munson type character. Next slide, please. So here's what happened. This was last year. This was exactly 4 weeks after I joined the night ministry. And here's what happened is at the beginning of November, he collapsed and he was brought to the hospital. He had COPD. He was diagnosed with COVID and enters the ICU. He was put on a BiPAP, on lots of treatment. He gets pneumonia, and he survives all of this through the ICU, which is incredible. You know, we know hundreds of thousands of people in the US have not survived this, and it is continuing on. So it was really amazing that he actually did survive. Now, about 2.5 weeks later, after he entered the ICU, he was discharged. That's what I heard from him. That's what I heard from his wife. We're not sure, you know, to this day, was he discharged? Did he leave? Regardless, he left the hospital after about 2.5 weeks. The day after, when he went back on the street, and he was discharged back to the street with no plan or shelter or anything for him and his wife, he was beat up on the street, and the EMS came, but he declined going to the hospital care. And when I talked to him, he said, "I'm okay, I promise." And I don't know if he knew what was going to happen, or he just really didn't want to deal with it, or what have you, but I just had a weird feeling that he was not okay. Next slide, please. So here's exactly what happened last year. Is on November 24th last year, I met with him and his wife, and I convinced them to go to the ER. Not for him, but for his wife. She had pretty substantial leg wounds, needed some refills on some medication, had missed her methadone dose, lots of things. And I convinced them to go, and we give them a ride to the ER. They stay there overnight, but then they leave AMA from the ER. I can't remember if the wife got treatment or not. And I asked him to please promise me that you will just talk to the doctor about what's been going on. He said, "Okay, dear, okay, I'll do it." I don't think he did. They left the next day to go see their kids. Obviously, it was Thanksgiving. They wanted to spend time with their family, so they did. And then they go back to Chicago on the 26th. The next day, his wife woke up and he was not awake. It wasn't an overdose. She's not really sure what it was, but we definitely know that being on the street and being discharged straight to the street absolutely affected his inability to survive all of this. Next slide, please. And this is it. This is what we have left. That is him. That's his wife. That's her engagement ring from him. And that's him. Those are his ashes. That's all she has left. She's still on the street. We see each other very frequently, and we have a very good relationship, and I'm really grateful for her. And I know that she was grateful for me being there for her, but it doesn't make this experience any easier. And as well, to have this happen again 4 weeks after I joined the job. Next slide, please. So in fact, I've had, me just personally at Night Ministry, I've had 3 people pass away in the last year. And I was looking at what happened to all of these people. And none of these were overdoses, which is quite ironic because I'm the substance use specialist. And surely we would think that my clients who are using opiates and other types of drugs would die of an overdose, but this was absolutely not the case. We have my client over here as represented by Apple Pie. We're not really sure what it was, but he definitely, you know, as you saw, had a really tough time for a few weeks. One of them, he was always very nicely dressed, and he and his partner lived in a car and tried to get around as best they could. They were also users, but he died of sepsis from wounds this past September. And then shortly after that, one of our other clients, represented here by the hand, she loved to draw. It was over the summer when we first started talking and I met her, and I have a tattoo of a butterfly, and she, every time I saw her, she would just start sketching my arm. And I really appreciated that about her. She just, you know, wanted to make art all the time. Now we know that none of these were overdoses. So what happened? They all had treatable and preventable things that didn't need to lead to dying. They all had probably a history of mental health issues, substance use. None of them were really able to keep a job and have money or stability. They all had been street homeless for 2+ years, if not more. And again, all 3 of these people had chronic conditions that needed to be treated, and they weren't being treated. Next slide, please. So how have I felt since, you know, we were asked to kind of think about what happens to the people who are working with folks? Well, I definitely have felt a lot of guilt about these things. I feel like I should have done more, even though I know I've done everything I could. I have felt extremely angry about why this has even happened and why we can just let this happen. And a lot of hopelessness of, you know, there's not really a way that I can really help people if this is how the system is and this is just a systemic issue. What can I really do? Next slide, please. So it was extremely hard to kind of pin down just a few things to say in this presentation, to be quite honest. Death is extremely hard to process, and death that comes from a failed system that is all around us and is all encompassing, but also the only thing that we have to work with at the moment is even harder to process. I'm extremely, extremely lucky. My partner, Jax is their name. They're studying to be a funeral director, and they're really passionate about processing death and dying. I have an in-house grief counselor, and I really recommend everybody go out and find one. I was having a really hard time trying to think of how to share my process through all of these deaths. And my partner reminded me of something that Cole Imperi, who is a thanatologist and the founder of the American School of Thanatology, said in a podcast that we listened to. And in this next quote, they're talking about how they're dealing with grief of losing their dad recently. Next slide. So Cole says, I don't think it necessarily ever completely goes away, because you're going to continue to see stuff and you're going to continue to be like, oh my God, my dad, he would love to see this. You'll get better at being like, he would love to see this, but I mean, you never, when someone dies, the relationship doesn't stop. You're going to continue to have a relationship with your dad. I was asked when I was interviewed for this position if I would be able to handle being around so much grief and also death. And I can't remember what I said, but obviously it was good enough because I got the job. But what I've learned through working through these deaths is exactly what Cole describes. Each instance is going to forever affect me in my work. And that is not something that I'm going to be sad or even scared about. And in our work, when you're working in this field, when you become jaded, you could become complicit to the stigmas and the normalization of death of our neighbors without homes. So keeping this fire lit under us, and you know, it's also the time where we're celebrating a lot of holidays that have to do with fire and keeping light alive during darkness. And I think that's really representative of how I've been feeling about this work. It's really key to living in solidarity with each other, especially as folks who are working in the field and people who are experiencing this. And Kiana's going to talk a little bit about that next slide. Thank you.
So I was going to talk about grieving together. You can go to the next slide. Next one, please. So when do we have the time to grieve? One of the things that was thinking about when we were creating this presentation is that being homeless is experiencing the same traumas over and over again. It's a constant cycle, from the street sweeps to the inadequate or harmful healthcare experiences, restricted opportunities for housing for people, whether that be based off of previous experiences in, federally or state funded housing, or being restricted from housing opportunities altogether for their past experiences in jail for previous crimes they were convicted of. There's just a nonstop cycle of trauma that occurs for anyone living on the street, there's really no time to process it all, which leads to the next point, which is grief is a communal process. We don't get through any of this without somebody by our side to walk us through that process. Like Yoel was saying, having an in-house grief counselor is very helpful and very useful. And our folks on the street, our friends and our neighbors, they need somebody to help them process that grief. Friends, family, any sort of way to acknowledge the loss of life or the loss of their home, the loss of whatever has led them to be in this situation. And there's no space for them to do that. There's no time, there's no opportunity, because there's constantly something to move you forward, or constantly something to push you, because you can't sit still for too long. Which goes into the last point of moving forward. How can we really move through the grief if the cycle is constantly going? When is the time for us to be able to process it all? When is the time that we get to take a break? When is the time that us as service workers, our clients out on the street, when can we all sit together and breathe for a second and say, this happened to us and this hurt, and I don't know what I'm going to do next. But unfortunately for our neighbors out there, they don't have the time, they don't have the ability, because that means not eating, that means not finding a shelter for the night, that means not getting to the next day for some folks. Next slide. You can go to the next one. So that brings us to our call to action. What can leadership do to help? I think the simplest and straightforward solution is to install dumpsters and portable bathrooms at encampments. People who live on the street are entitled to privacy. They're entitled to some sort of self-autonomy, to be able to clean up after themselves and make this place their home, because it is their home. There is no other option for people at the moment. We don't have, the funding is not going where it needs to be. So if this is the solution for people, then we need to make it as easy as possible for people to survive out on the street. We also need to be putting funding towards emergency shelters, where people can have privacy, where they don't feel in fear of leaving their stuff by themselves, and fear of having their items stolen, and fear of them being hurt. We need funding towards short-term housing so that people can transition from those emergency shelter situations. And we need more funding towards permanent supportive housing. And then the last thing is that we need to learn to engage with our neighbors. Anytime you walk down the street and you see somebody panhandling, or they're staying in a tent or what have you, just say hi. It starts like that. It's just simple. Get to know people and their stories. That's how you build connections. That's how you learn to find the humanity in everybody else. And that's how we all learn to collaborate and come together and move forward. Next slide.
And you can go to the last slide. So thank you everyone for listening to us talk about our experiences and our work that we do at the Night Ministry in Chicago. We put our contact information if you want to contact us at all. Please feel free to call me, text me if you need anything or just want to talk about anything. We really appreciate the opportunity to be able to share our stories with everybody here.
Thank you.
Thank you, Kiana, Yoella, both of you, Yoella and Kiana, thank you so much for sharing the beautiful stories, your own insights and perspectives, but also giving us, right, strategic things to think about and recommendations. We really appreciate you both being here today and sharing, so thank you. I'm now going to introduce our final speaker. Our final speaker today is Kendall Clark. And Kendall is the peer advocate on the National Consumer Advisory Board. Kendall is also a member of the co-applicant board for the City Newark Mary Eliza Health Centers, where he has served for over 10 years. He is a board member of the North Jersey Community Research Initiative, Pride Center, and again, has a very beautiful, extensive bio here, including being a member of City of Newark's Mayor's Homeless Commission and involved in a number of organizations, especially supporting people living with AIDS and working to remove lead in Newark. Kendall, thank you so much for being here today. Kendall? Kendall Clark? Okay. Well, we may be having some technical difficulties. So Kendall, if you're able to maybe join us or join on chat. But I would like to say, you know, as we are doing our national memorial today, we really want to thank cities and communities across every state and the District of Columbia for commemorating precious lives and honoring people. Our mothers, fathers, brothers, sisters, friends, neighbors, fellow human beings who have died from poverty and homelessness, knowing that, again, everyone deserves life, liberty, and the pursuit of happiness. Homelessness is a public health and humanitarian crisis. So thank you to all who have joined us today for our national memorial. Today is a memorial, and it is also a collective call to action, asking that we march forward with radical empathy, revolutionary love, intentional action to advance housing justice and promote human rights. Because housing is a human right. We all deserve safe, affordable, accessible shelter, a fair living wage, access to food, clean water, high quality and inclusive education, and high quality public health. In one of the wealthiest nations in the world, millions of people should not live in extreme poverty and extreme death and loss, experience homelessness. Over the decades, we have lost too many precious lives, and that should not and does not have to occur. And so today we grieve. We know that we must do better. We must love more fiercely, move from trauma to healing, ensure that everyone has housing. As Dr. Martin Luther King Jr. wrote in his letter from Birmingham, Alabama jail on April 16, 1963, injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly and directly. And so today we grieve, but we also rise together. We also march forward together for housing justice with hope. Hope that no one else has to die, and that those that have died are honored and resting in peace and power. I'm going to now turn it back over to amazing leader, fierce advocate, Bobby Watts. Thank you all again for being here. Namaste.
Namaste. Thank you so much, Dr. Shankar Brown, for your opening remarks, those remarks. I really want to thank all of our tremendous speakers. We know that Kendall Clark is here. He's having some technical difficulties. He's sorry that we're sorry that we will miss his powerful voice. But really want to thank speakers for sharing their perspectives on homeless mortality. And I hope that each of us have learned more about how we can have healing for ourselves while fighting for healing for our patients and our neighbors without homes, which is really part of a larger struggle for healing of our society. A society that has so many people experiencing homelessness, as Dr. Shankar Brown said, in one of the richest countries on earth, shows that something is wrong with our structures, with our systems. We understand that race and racism play an outsized role in who experiences homelessness and how many people experiencing homelessness in this country. I'd like to thank the staffs of the National Coalition for the Homeless and the National Alliance in Homelessness who have worked behind the scenes in preparing for this. And I also want to, especially those that I've worked most closely with, the staff at the National Council for the National Healthcare for the Homeless Council, Meredith Malika, and also especially Corinne Lovett, who has answered all my questions, helped me get prepared, and really want to thank them and all of those that are here. I see Kendall is here. Kendall, can we hear from you in 2 minutes? Can you summarize what you're going to say in 2 minutes? And then we want to have the names of those who need to be remembered on the screen. So Kendall, if you can talk, we'll turn it to you for a moment.
So, sure. My name is Kendall Clark, and most of you know my bio. I've been with the National Healthcare for the Homeless Council for a while. I've been in national homeless healthcare advocacy for more than 27 years, being a member of the National Housing Coalition, as well as a longtime member of the National Healthcare for the Homeless Council, and I have applied for the National Alliance to End Homeless as a member. I've been on a couple of their conferences, so I've been around for a while. So, at least 20 people a day, according to data from Washington University, that 20 people a day who are homeless die. And some of them die from faults of them, not their own, most of them, but a lot of them die from, overdose, which we know is a major cause. And a lot of them die from chronic illnesses, which are totally manageable and avoidable, but yet don't have access to their high blood pressure medication or their diabetes medication. So we know that that's an issue, and also in 2020, we had an exact amount. There was 7,877 persons who died homeless around the country. And we see that the deaths are surging. New York and Los Angeles, who, major metropolitan cities, have the rise in most deaths when it comes to homelessness. And as Dr. Rashi said before, housing is a human right. And it's also one of the major components in you continuing your health care. Because if you don't have, we want mansion and yachts, but we need refrigerators and lights just to refrigerate the medication and to see the correct doses to give ourselves. And, every year we pay homage to those of our neighbors without addresses. Again, we pay homage to them. So, Robbie, I guess I have my 2 minutes, but I just wanted to let you know a couple of successes in the city of Newark, where in all my years of advocacy, this is the most that's been done in the city of Newark, New Jersey for homelessness. The success of our own Office of Homeless Services, instead of going to the Department of Health or to the Department of Homelessness, the city of Newark has its own Office of Homeless Services. We have our new homeless czar, who's been given a $14 million budget, where our first container project was very successful. It's called Hope Village 1, and we're now developing Hope Villages 2 and 3. But what's ironic about it is those higher education institutes in New Jersey, the New Jersey Institute of Technology, Rutgers Development Corporation, they want to get involved in our container project. So that's a great thing, because we did, the guys over in England who we originally did the first container project were very helpful. Very, they provided what we needed. But now that we know we have people right in our backyard who can provide those same services, and they want to give them to us at, some of them want to give it to us at a low rate, volunteer, but at least we're headed in a new direction. So I just want to say, as far as our neighbors without addresses and them dying, we know that a lot of these things are avoidable. And one of them is getting them adequate low income subsidized housing, getting them housing that they can afford, getting them safe and affordable housing, and so that they can thrive as human beings. And my last note is that most of the people who are homeless, I'm not saying all, but more, had careers, had jobs, and now you've got people with PhDs and doctorates and things like that who are now coming to our soup kitchen and are eating every day. And I definitely connect with some of them because those of them who have the degrees, they talk to me and they say, well, how you used to do this and I used to do that. And I'm not saying, come on over, maybe we can sit down and talk, put our heads together so we can. And one of the guys gave me an idea of getting a registry together. So when people who are homeless die, we know, instead of us digging through that thing and rummaging through that thing to find a closest family member, start a registry so we'll know that when this person dies, we'll have the information to contact their family. Thank you, everybody, for that short, informative little dig there.
Thank you very much, Kendall. Thank you. And Kendall is such a great example of someone who has taken their lived expertise, paying it forward to and directing services, helping us at the our National Consumer Advisory Board. And it's important that we listen to the voices of people with lived expertise and the providers that work intimately with them. And we need to be advocates for change. If we're going to heal our society, we need to be advocates, and anyone can be an advocate. And we hope that you will take on this challenge so that we can be the real agents of change with the knowledge of what we know, of what we see, and what we know to be morally right, to have that propel us forward and inform the public dialogue and the public policies. I'm going to ask that we again engage in a few seconds of silence, 20 seconds of silence. And then after that, ask that we play some music in the background and scroll the names of those that we want to honor and remember. Please, a moment of silence in any way that is meaningful to you. Thank you.
fascinating.
Thank you all
Absolutely.
for continuing with us as we saw the names for remembrance. And we hope that you will, as I believe it was Ann Oliva said, take the remembrance with us, not just today, but throughout our work throughout the year, knowing we have many more of our homeless neighbors that need shelter and housing so that they can have a full life and a full lifespan. Thank you. Have a wonderful rest of the day and continue forward in helping to heal our society and our neighbors.